Could Mpox be the next big global health scare like COVID?
Mpox is not the new COVID. Regardless of whether it's Mpox clade 1 behind the ongoing outbreak in East Central Africa or Mpox clade 2 behind the 2022 outbreak that initially impacted Europe and has continued to circulate in Europe since.
The WHO declared the Mpox outbreak in parts of Africa a public health emergency back in mid August. And as of August 22, 2024, more than 14,000 cases were reported, with 457 deaths, a sharp rise from 2023. Mpox, a viral infection that causes pus-filled lesions and flu-like symptoms, is generally mild, though it can be deadly. But it's not likely to reach COVID level of chaos, at least for now. One of the biggest issues now is the vaccines. Despite the surge in cases, African nations are struggling to get vaccines. For instance, Nigeria only got its first batch of 10,000 doses from USAID on August 27 since the outbreak, while the European Union and the United States have promised to send about 380,000 more. However, this is still far from enough. Currently, there are three vaccines available globally for Mpox, and they are all based on a weakened version of the vaccinia virus. One is LC16M8, approved by Japan, and another is ACAM2000, made in the US. But here's the kicker: these vaccines are pricey, costing around $50 to $70 per dose for African countries, which is a huge burden for many low income nations. Over 70 countries outside of Africa have already received these vaccines, leaving African nations once again playing catch up. And why the delay in getting these shots to Africa? Turns out the WHO has been slow in giving the necessary emergency approvals for Gavi and UNICEF to purchase vaccines. WHO's Director General Tedros Adhanom Ghebreyesus said last month that part of the holdup is because companies haven't completed all the paperwork. This delay has even forced African governments and health agencies to instead request donation of shots from rich countries. Another reason is that during previous Mpox outbreaks in 2022, the number of cases remained quite low and many African countries did not ask for Mpox vaccines as health officials had to tackle far more serious health problems in the region. While Mpox might not turn out to be the next COVID, the way the world handles it has a lot of similarities to COVID, especially when it comes to vaccine access.